So people who have sleep apnea, we want to test them. We want to know what medicines they're on. We want to know they got stress, anxiety, eating, premenstrual eating syndrome, carbohydrate issues, binge eating disorders, what their heredity is. All these things go into this funnel. Now, we can take this funnel and block it here using appetite suppressants. And in fact, people lose a lot of weight by doing that. I use appetite suppressants in my patients, use them all day long. I'm not against them. You have to make sure there are no contraindications. Not everybody qualifies for them. There are FDA criteria that help you decide that, and we're compliant with that. But if we're not figuring out what's going on here, at some point, these medicines leave, these factors have not been modified, and Miss Piggy comes back. Oink, oink. Not good. No. We want to deal with this, and many of these things are amenable to medical care. There are medicines that help decrease the desire to have carbohydrates. There are medicines that are very useful to avoid premenstrual eating. There are many medicines that are very useful to work with stress and anxiety-driven eating. Binge eating disorder is also amenable to medication, to pyramate in particular. There's night eating disorders. There are other things that we can talk about. But a lot of these things are amenable to medical care. Why get your weight loss services with a medical bariatrician? Because we have what we call in the Army command and control authority. As physicians, we are able to prescribe for these issues. We are also able to unprescribe as we start to solve these things in cahoots, in coordination with your family doctor or your internist or the other person who's dealing with you. If I'm going to start taking you off a bunch of these medicines, I want your primary care doctor, your internist, your cardiologist, your endocrinologist to know why we're doing it. Or we're going to have medical mumbo jumbo. It's like jambalaya, and that's not good in terms of your health care. It tastes great if it's on a plate, but it's not good in terms of your health care. So no jambalaya in terms of your health care. It's very tasty stuff. It's also fattening because it's full of carbs. All right, so we want to, at some point, lose the weight and not regain it. This is the battle of the century. I can make this eraser lose 20 pounds. The question is, can I keep the eraser from regaining the 20 pounds? I can make the chair lose 15 pounds, but will the chair not regain 15 pounds? And that's really where the battle line is. So we can get you from here to here, no problems, no questions asked. I can calculate a caloric deficiency, knowing what your total daily energy expenditure is, how much you actually need. A lot of people need 1,600 to 2,000 calories a day for their total daily energy expenditure. If I put you on 800 to 1,000 or 1,200 calories a day, believe me, there's a huge deficit. You're going to lose weight. It's just a mathematical thing. The universal laws of thermodynamics will not be violated, not by you or anybody else. You have this deficit, you're going to lose weight. So we lose the weight, and this is what we don't want. We don't want to regain it. How do we not regain it? Well, we talked about some medicines that have to do with these things, and sometimes we use them so that people don't regain their weight. But behavior modification. As part of the weight loss process, you need to be taught and be willing to learn and implement the behavior modifications that are necessary, lifestyle choices. We've talked about medications, they're all wonderful. I'm a pill guy, I give pills, that's fine. But the answer is not in any of the pills that I give. The answer is in being able to modify what you're doing. Sometimes with psychiatric help, sometimes with counseling, sometimes just by a brick hitting your head and saying, wait, I've been doing that wrong? I don't want to do that wrong anymore. I want to do it right so that I can live and have a successful family and protect my children and be around instead of being a burden and a problem to those that I love. So we want to do this, and then we don't want to regain. Maintenance is critical. And one of the most important factors in maintenance is activity. Well, wait, I just said a few minutes ago that activity wasn't that useful for weight loss. And in fact, it's not. But it's very useful in weight maintenance. Because in weight maintenance, this deficiency, which is what really causes weight loss, is gone. We're then going to give you the number of calories, or you should be ingesting the number of calories that you actually need. So we're no longer dealing with a deficit. Now exercise and activity are important. In our program, we have a weight loss guarantee. If you lose 20 pounds, 30 pounds, 50 pounds, whatever that is, in weight loss, we want you to be in the maintenance program. In maintenance, you come every 6 weeks for 6 months. If you regain 10% of what you lost, if you lost 50 pounds, 5 pounds. If you lost 30 pounds, 3 pounds. If you regain 10% of what you've lost, we'll put you back into weekly treatment for free. $0, 0 cents. As far as I know, nobody does that. Including all your medicines, anything you need, it's free. Because it's simple for me to get you to lose 3, 4, 5 pounds. People do that in a week. So what we want to do is keep you down and keep you well.